morning. I'd like to call the meeting of the board to order. Will the secretary please call the roll?
Director Bott?
Here.
Director Curry is absent. Vice Chair Deere is absent. Director Garza is absent. Director Harrington?
Present.
Director Kim is absent. Director Ryder?
Here.
Director Robinson?
Present.
Director Sorrell? Present. Director Story is absent. Director Webster Cross? Present. And Chair Taylor?
Present.
You have a quorum.
Thank you. The next regular meeting of the board will be held on Friday, June 30th at 9 a.m. The first item on today's agenda is a brief overview of the COVID-19 protocol and guidelines as we return to meetings in person this month, which will be reviewed by Dr. Sharon Wellbill. Dr. Wellbill.
Good morning. Thank you. So these are the guidelines and protocols which are subject to change based on public health guidance for the in-person public meetings of the Cook County Board and Committee. Unless otherwise noted, masking will be optional in the boardroom for the CCH Board and Committee public meetings. Masking continues to be strongly recommended for all individuals in CCH facilities and is required in certain areas. The setup for this public meeting in rooms 5301 and 5302 of the professional building is well below the room's maximum capacity to accommodate a generous amount of personal space for attendees. If the room's maximum capacities are reached, then masking in the rooms will be required. Please do not attend the meeting in person if you are experiencing COVID or flu-like symptoms or any other respiratory viral symptoms, such as coughing, fever, body aches, and so forth. And for those persons who are unable to attend the meetings in person, the live stream meeting is available on the CCH Board's YouTube channel, and the link is on the CCH website. If there's not any questions? Thank you.
Thank you very much, Dr. Wellbill. The next item on today's agenda is employee recognition, which will be reviewed by, you're going to do it? Mr. Rocha. Thank you.
Good morning. I'm actually doing it from the second. We have some special presentations we want to make before the board. So good morning to everybody. First, we want to start with our welcome and review some of our new hires, actually. So I'm going to, I'm sorry, I can't see that far real quickly. Actually, why don't we review that afterwards? Can we go to the recognition first? Thank you. So we'd like to start with a few recognitions this morning. First, we want to recognize our entire team at Stroger Hospital for achieving a leapfrog score of a B. We're very excited to be able to bring that news to you. It's our highest score that we have received to date, and so we're excited for all the work that was done. As we remember, leapfrog is a scoring modality that reviews several factors from quality outcomes to performance, HCAT scores, our patient's voice, and several other indicators. So we wanted to have a recognition and congratulations to the Stroger team for earning a leapfrog B. Providence Hospital is not yet scored because of their volumes, but they are very close to crossing the threshold because they have been increasing their volume, and so very soon we hope to have 2 hospitals to recognize. But if we can please give a congratulations to these Stroger teams. And first, I also want to recognize that we have an appointee to the State Board of Health from the Cook County Health family. Dr. Julie Nowinski-Konchak was appointed by Governor J.B. Pritzker, and she was appointed as, she currently is the Program Director of Public Health and General Preventative Medicine, and she was appointed to the Illinois State Board of Health. Congratulations, Dr. Also, we want to recognize an outstanding achievement in our workforce and labor leadership. Roy Chavadil is a medical technologist in cardiology and was a recipient of the 2023 Outstanding Achievement in Workforce and Labor by Illinois Treasurer Michael Fritz. during the annual celebration honoring unique contributions of Asian and Pacific Islander Americans to the state of Illinois. Congratulations to Roy. Also, we want to recognize our April Commitment to Excellence Awards. These are awards that are recognized by both our patients and our staff for individuals who have gone above and beyond in being able to provide care and ensure a safe and quality environment of care for our patients. We have two individuals with us today that we will recognize first, and we have Paige Williams from our Environmental Services Department. And Andres Brooks, who is also with us from our Environmental Services Department. Also being recognized by their team and not in attendance is Taya Jones-West from our Finance Department, Angela Wilford from our Patient Relations Department, Karen Malicia Otis from our Pharmacy Department, Omar LeBlanc from our Pediatrics Department, and Catherine Radigan from our Pulmonary Department. And so again, we want to congratulate these exceptional individuals for going above and beyond and creating an ideal and patient-friendly and patient-safe environment of care. Thank you so much for your leadership. Also, we have that same award. That was for April. We have our May award recipients. And with us, we have with us in attendance from our Care Coordination Department, Quinnia Hearn, who is with us as well, who was recognized. Thank you so much. Also being recognized, but on duty and not in attendance today, is Dr. Rami Dookie from our Cardiology Department, Sandy Oliphant from our Complex Care Department, Maria Rodriguez from the Austin Clinic, and Patricia Salgado from the County Care team. Congratulations to each one of these winners. Thank you so much for going above and beyond. And every year, our Graduate Medical Education Department has an amazing institutional research day where we are able to display exemplary works to advance the field of medicine through research, science, and discovery. And we are so happy to be able to present some of our institutional winners and our research winners today. And some are in attendance with us, and some will be getting them their plaques later. But we want to congratulate them. So if you hear your name called and you're in attendance, please come up, and we want to recognize you. So for our first place in our platforms division, we want to bring forward Dr. Eileen Yang. All right. Give me 1 second to do that. Here you go. Thank you so much. In second place is Dr. Leslie Cachola, and she is not with us today. We also have outstanding presentation in our Institutional Research Day winners. And for our outstanding presentation for Session A, we have Dr. Derek Hilgers and Dr. Allison Bessa. And they're on duty today, cannot be with us. In our Session B, and with us today is, if you can come up and we'll give your plaques all at the same time. If we can have Dr. Dae-Young Park to please come forward, Dr. Sanya Salim, and Dr. Dennis Kumi to please come forward. Why don't you all come back up? So we can do it together. You can get the board. Congratulations. And in Session C, we have Dr. Christian Martinez, Dr. Mario Hua, Dr. Arisha Wadwa, and Dr. Mawash Siddiqui to please come forward. Congratulations. We also want to thank our extraordinary Institutional Research Day Committee for putting this together, Dr. Michael Hoffman, Dr. Amina Kokar, Dr. Mark Meidick, Dr. Julia Nowinski-Komchak, Dr. Katuyun Rizia, Dr. William Trick, Dr. Asamota, and also Eric Christian and Estelle Hu, who are with us as well. So thank you so much for bringing forward research to our institution and for recognizing us today. And for that, I'm going to turn it over to Ms. Valerie Amos. Is she with us to go over our employee recognition?
Good morning. This is Valerie Amos, Chief Human Resources Officer. I'm very excited to share and welcome a number of our new hires and promotions. So Andrew Baranski, he is the Director of Operations, Health Plan Services. Gerlene Bender, Manager of Clinical Excellence and Performance Improvement for Quality Assurance. Iva Elliott, Health Plan Training Manager for Health Plan Services. Thomas Estiacio, Physical Therapy Manager for Providence Physical Therapy. Valerie Gantert, Managed Care Clinical Operations Manager for Managed Care. Guadalupe Garcia, Director of Language Services for Interpreter Services. Next slide, please. Terry Graham, Manager of Business and Finance Operations for Ambulatory Services Administration. Jawan Lasley, House Administrator for Provident Nursing. Dr. Jai Mehta, Chief Financial Officer for Health Plan Services. Angelique Mumman, Enrollment and Retention Manager for County Care. Ann Murphy, Patient Safety Manager for Quality Assurance. Andrea Norman, Delegation and Vendor Oversight Manager for Health Plan Services. Next slide, please. Jacqueline Rodriguez, Senior Manager of Financial Assistance for Revenue Cycle. Anaya Stoller, Maternal Child Health Program Manager for Health Plan Services. Bettina Tassin, Network Diabetes Program Manager for Endocrinology Clinical. Willina Marie Valencia, Nursing Service Business Operations Manager for Administration. Craig Williams, our Chief Administrative Officer for Operations and Development. Next slide, please. In addition to our new hires, our external new hires, we have some internal promotions. Carolina Dusak for Chief Plan Officer, Medicaid Health Plan Services. Tracy Everett, Associate Director of Nursing, Emergency Services Nursing. Anita Redding Hoffman, Ambulatory Clinic Manager for Administration. Jackie Lee, Nurse Coordinator 2 for CORE, Patient Care Services. Next slide, please. Juju Lacose, Nurse Coordinator 2 for the Burn Nursing ICU. Christina Urbina, Service Line Business Director for Administration. Dr. Sharon F. Wellbell, Chief of Epidemiology and Infection Control, Medical Administration. And Andrew Wheeler, Manager of Trauma Recovery, Intervention and Prevention for Trauma Administration. Next slide, please.
I believe that's it.
Please join me in welcoming all of our external new hires and our internal promotions.
Thank you very much, Ms. Amos. The next item on today's agenda is public testimony. As a reminder, written testimony will not be read into the record, but will be included in the official record of this meeting and posted at the website. Madam Secretary, do we have any speakers who registered to provide in-person or virtual oral testimony or submitting written testimony?
We did. We received 4 registrations to provide virtual oral testimony, and we received 1 submission of written testimony that will be emailed to you, posted to the website, and made a part of the record.
Thank you very much. We proceed.
The first speaker is Debbie George. Are you present?
Yes.
And just a reminder, You have 3 minutes to present your testimony. When you have 30 seconds remaining, I'll remind you, and also when your time has elapsed.
Sure. I am Phoebe George, currently working as a clinical nurse in cardiac ICU at Georgia Hospital. I have been employed at County for the last 2 years in a variety of settings like telemetry, floor, critical care, and ambulance transport member of the United ICU. I completed my master's degree in nurse practitioner track at County 2 years ago, and ever since I was trying to get an APR in job. Since advanced practice provider positions in County are only being filled with physician assistants, RNs who graduated as APR do not have any growth opportunities. In order for me to work at my full potential, I will have to find a position outside of County and have to leave with disappointment after all these years. Thank you.
Thank you. The next speaker is Indu Abraham.
Hello.
Hello, we
Hi,
can hear you.
it's Indu Abraham. I'm currently working as a clinical nurse in CCH at Georgia Hospital for nearly 10 years. I'm also a postgraduate graduate nurse practitioner waiting to pursue a clinical position in Cook, where I can transition my clinical skills, clinical experiences, and knowledge wisely. But currently, PAs and NPs cluster as advanced practice providers. I'm here to raise my opinion where Cook County is oversighting and policies. Cook County or HR is not having NPs, and those positions are getting eliminated as PAs, physician assistants. Each department is allowed to have PAs and NPs, but then if you look at the previous years provided, those allotted NP positions are placed as PAs, which shows that fewer NPs are not being getting placed. I was sent to school and all the country as a gratitude, I would like to use my talent and skills back in Cook County and uplift our community with better quality. Thank you for listening to me.
Thank you. We have 2 other registered speakers that we're having some challenges getting them connected. So, would you like me to continue trying to get them connected and we can move on to the next item?
Let me know when please let us know connected.
Will do.
Thank you all. And for those who are not speaking virtually, I'll ask that you mute. It may help with some of the background noise if you're not actually speaking. The next item on the agenda are the board and committee reports. Please let me know. The minutes of the April 28th board meeting are being presented for your approval. I assume everyone had a chance to review the minutes and notes. Are there any corrections or revisions needed to be made to the minutes? Hearing none, I'd like to entertain a motion to approve item 5A, April 28th board meeting minutes.
Second.
Thank you. The motion has been made and seconded. All in favor?
Aye.
All opposed? Thank you. The ayes have it. The motion carries. Next, Director Robinson will now review the Human Resources Committee meeting minutes.
The Human Resources Committee met on Thursday, May 18th at 12 p.m. The next regular meeting of the Human Resources Committee will be held Thursday, August 17th at 12 p.m. We received a report from the Chief Human Resources Officer, which is included in the minutes, and the information and the subjects in general that were covered are as follows: fiscal year 2023 impact summary and HR activity report regarding hiring. Fiscal year 2023 impact summary and HR activity report regarding turnovers and separations. And she also included the turnovers pre-pandemic, so we could get a pretty good view of what happened prior to the pandemic and what's happening now. She also covered health fairs that have been taking place in fiscal year 23 year to date and gave a summary of it. At the end, the appendix included HR optimization and digitization, proactive candidate sourcing, CCH career site refresh, outreach and marketing, advertising package, and vendors PMO contract services summary. There were 2 requests made for the following at the meeting. Regarding separations and exit summaries, Ms. Amos will verify whether a question is included in the exit summary as a reason for an employee leaving is due to diversity, equity, and inclusion issues. If not currently included, one will be added. During the discussion of the data on retirement, a question was raised regarding how the tenure of individuals break down. Ms. Amos responded that she will provide information on that subject offline. There were no action items presented for consideration. Committee did not go into a closed meeting. If there are no further questions, the minutes are being presented for approval at this time.
Are there any questions? Thank you. I'd like to entertain a motion to approve item 5B, May 18th Human Resources Committee meeting minutes.
So moved. Second.
Thank you. The motion has been made and seconded. All in favor?
Aye.
All opposed? The ayes have it. The motion carries. Next, Mr. Aaron Galena, with us, I believe. Thank you. We'll now review the Managed Care Committee metrics. That committee did not meet this month, so the metrics are being presented directly to the board. The next meeting of the Managed Care Committee will be held on Friday, July 21st at 10:30 a.m.
Good morning, Directors. Aaron Gleaner, Chief Administrative Officer. We'll start today with our usual metrics, beginning with membership. We are at 455,000 members as of May. We continue to see somewhat steady growth into the plan of a couple thousand members per month, and that looks like it continues into June based on recent numbers as well. If you go to the next slide, you'll see our market share data. We continue to hold right around 32.5%. The rest of the market is also relatively steady, so we continue to be the largest Medicaid managed care plan within the county. This slide shows our trends in enrollment growth versus the overall Medicaid managed care market. You can see we've tracked really closely overall to that overall market growth and have really stayed pretty consistent with that for the past 18 months. The next slide shows our budget versus our actual membership. Actual here is in the red bars, budget is in blue. You can see that we continue to significantly exceed our budget. We, of course, plan for redeterminations to start at the beginning of this year, which is why we assumed lower budgeted membership over the course of the year. We now know that those redeterminations have kicked off. Members have started getting initial letters in the mail right at the beginning of May, so we expect the first potential coverage losses that we will see to start in July. This slide shows a summary of how many members we're expecting to go through the redetermination process by month. If you look at the columns, the far right column shows the total number of members up for redetermination, which is around 28,000 for this first month, and ranges generally between 30 to 40,000 members each month. Only a sub portion of that will have to submit paperwork back to the state. Some members will automatically requalify. So the left-hand column there, what we call Form D members, are those that will have to submit paperwork back, and that generally ranges between 20 and 30,000 individuals each month. The next slide shows our operations metrics, which continue to be within our SLAs and have held steady for the past couple months. Then our next slide shows our inpatient utilization per thousand. We continue to see good trends year over year. Red bars here are prior period, the blue bars are current period, and so we continue to see improvement in inpatient per thousand utilization year over year. The next slide shows our COVID vaccination rates, which has continued to remain fairly steady over the past couple months. In the plan, we continue to have multiple efforts to encourage vaccination, particularly the boosters within our population. The next slide shows our claims payments. These continue to hold pretty steady right around the 30-day mark. And if you look at the next slide, this breaks it down by aging of 30, 60, and 90 days. And you can see that the main column we continue to monitor is that 30 to 60 day where we're continuing to try to drive down our aging claims. And with that, I'm happy to answer any questions.
Directors, do we have any questions? Thank you. I don't have a question, but I have an observation. I think it's very good to see the IP acute numbers coming down. I mean, it's proof that actually providing care keeps people out of acute situations, which I think all of us support. So thank you. We appreciate it.
Chair Taylor, we do have the speaker who has joined us.
Perfect. Thank you very much, Ms. Galena.
Thank you.
Our board of directors, those of you know, we had a speaker who couldn't connect before, so we'll return to our public testimony and come back. Please.
Thank you. The remaining speaker is Patricia Izarike. Patricia, are you with us? Patricia, if you're with us, you are on mute. Patricia, are you there?
Okay, so maybe we will not. We'll come back to it again when we can connect, Patricia. Thank you. Next, Director Bott will review the Quality and Patient Safety Committee meeting minutes. Director Bott.
Thank you, Mr. Chair. Good morning, everyone. The Quality and Patient Safety Committee met on Thursday, May 18th at 10:30 a.m. Note, we're not planning to have any re-review of metrics and presentations from the meeting, but if any additional questions are raised, staff will be present and ready to address. Thank you. The next meeting of the committee is Thursday, June 22nd at 10:30 a.m. The committee received the following reports, which are included in the minutes. The HRO dashboard. The committee reviewed metrics from the following HRO work groups: patient experience, clinical documentation, clinical outcomes, readmissions, throughput, and HEDIS measures. Received regulatory and accreditation update, which is included in minutes. Received an update from the HRO HEDIS work group, which is also included in the minutes. Received EMS and MEC reports as well. The committee received the Stroger Hospital Quality Committee summary for informational purposes. There was a request from Director Story, who asked to receive regular updates on the subject of work being done to increase access to the patient portal. The first quarterly report on the subject is tentatively planned to be presented to the board in July. The committee approved the following action items, which are included in the minutes. Approved the Stroger Provident Hospital medical staff appointments, reappointments, and changes. The committee did not go into closed session, but we're not expecting to, correction here. The committee did go into closed session, but we're not expecting to re-review the information. So the minutes are being presented to the board for consideration at this time.
Thank you very much, Director Bott. Any questions? Okay. I'd like to entertain a motion to approve item 5D, May 18th, Quality and Patient Safety Committee meeting minutes.
I move to approve the motion.
Thank you, Director.
Second.
Thank you, Director. The motion has been made and seconded. All in favor?
Aye.
Aye. All opposed? Hearing none. The ayes have it. The motion carries. I'd also like to entertain a motion to allow Director Story to participate remotely. He's as a voting member at this meeting. He's joined us via Teams.
Second.
The motion has been made and seconded. All in favor?
Aye.
Aye. All opposed? Thank you. The ayes have it. The motion carries. Do we have the remote testimony?
Okay, calling on the public speaker, Patricia Izarike. Are you present? If you're speaking, you are muted.
Okay, thank you. Next, Director Ryder will review the Finance Committee meeting minutes.
Thank you, Mr. Chairman. The Finance Committee met on Thursday, May 18th at 9 a.m. The next meeting of the committee will be held on Thursday, June 22nd at 9 a.m. We're not planning to have staff read review reports and contracts for the meeting. However, we will have a slide with a list of the contractual requests over $1 million, which will be up on the screen. And we do have folks, Charles, Pam, and staff will be present and ready to address any questions that anyone has. The committee considered the following action items, which are included in the minutes. We conditionally approved 19 contracts procurement items. Request number 3 was withdrawn from consideration. Number 6 and number 20 are pending review by contract compliance. The committee also received and filed grant award related items and transfers of funds. The committee received the following reports, which are also included in the minutes. The MBE WBE report, one report of emergency purchase, and a report of the fiscal year 2023 financials. I would ask if anyone has any questions for myself or for staff. Otherwise, the minutes are being presented for the board's approval, Mr. Chairman.
Thank you. Directors, any questions? The minutes of the meeting? Thank you. The motion has been made and seconded. I'm sorry, we have not. I'd like to entertain a motion to approve item 5E, May 18th Finance Committee meeting minutes.
So moved.
Second.
Thank you. Now, the motion has been made and seconded. All in favor?
Aye.
Aye. All opposed?
I'm sorry.
Actually, we have a correction.
No correction. That's the opposal. I just have, I want to record me as just voting present for item 1 through 3 for the contracts and procurement items contained from the May 18th Finance Committee.
Thank you very much. Okay, thank you. Again, the ayes have it, the motion carries. Noting Director Cross. I don't believe we have any contracts being presented directly to the board for consideration. So if there are no other questions on the minutes and the actions items being presented for consideration, we can move on. Any questions or considerations? Thank you. That will be my report, which will be brief. First, I like to, I had the privilege of joining Wednesday, right? The Nurses Excellence Award along with Director Harrington and Director Curry for this week to actually honor our nurses and thank them for all the work they do. It was a phenomenal event. Well done, and I'd like to, one, just thank all of our nurses and congratulate, thank all the nurses and congratulate the Excellence Award winners. Well done, and we celebrate you and appreciate you. Second, I'd like to, again, add my congratulations to the April and May commitment to excellence awardees. Again, we really appreciate all the work that you do and continue to excel in the care that you provide our patients. As well as the Institutional Research Day. I mean, I'm odd, award day winners. I'm odd and inspired by all their work. And if you look at the work that they've done, I'd encourage you to do it on the research, and you see that the research is an effort to support the broader efforts of CCH here. And finally, I'd like to welcome our new employees. And I thank Ms. Amos and her team for actually the hard work that they do. Quite frankly, if you notice, we've had 11 jobs. So those who know, we've had 11 job fairs over the last fiscal year, right? Actually, things we didn't have before. To actually go and take Cook County Health to the community and encourage them to join us. And so we're starting to see the results of that. And I'd like to really appreciate that in the new hires. And then the congratulations to those who are promoted, right? Job well done for new responsibilities. We appreciate you and support you. And by the way, I'd like to thank Sam for helping us here, right? This is hard, right? Through COVID, we had virtual, we had hybrid and virtual, and now we're in person. And he and Debbie have figured this out and continue to make this happen. So we want to thank you and we'll let you know we really appreciate you for that, for all you do. Finally, a not so happy note. Earlier this month, we received notice that Director Kim, one of our directors, that she will be resigning from the board effective June 1st. It's sad because she's leaving us, but she's resigning because she's actually an appointment to be named to take a new role outside the state in a very senior, visible role. So we will congratulate her, as we also actually be saddened by her loss, because she's contributed greatly to the board, and we'll actually hope she will join us at least remotely in our next meeting, so we can do that directly. She wasn't able to attend today because she's actually transitioned into her new executive role. So that is it for me. I really appreciate it, and I will finally say I'm excited to be here with people. This feels different, like in a good way. So, I'm excited to be here with all of you. I appreciate it, Mr. Roach.
Thank you so much, sir. It's sort of like going back to school again for the first time. There's an excitement. Before I get started today and go over our system updates, we did request and got a lot of questions that we've been getting over the community from some of the board members to review what is, there's been some coverage about COVID-19. We just talked about that we're now in person without masks and excited to be here today. But there was also some questions that there's been some news coverage about some elements that are happening in China. And so I wanted, before I get started, to recognize Dr. Welbel, who's our newly appointed Chair of Epidemiology and Infection Control, to review with us real quickly some of the occurrences in China for the board and the community, since we have received a lot of questions before I start my report. Dr. Welbel?
Thank you. Thank you for the opportunity. So in relation to what Mr. Rocha is saying, there's been a fair amount of news about increased cases of COVID in China, and what does that mean for the rest of the world? Well, we know that there have been clusters of cases in other countries, like India with XBB 1.5, which is currently the predominant variant of COVID that's circulating in the U.S. It's about 65%. What happened in China? We know that about 6 months ago, they completely dismantled all of their COVID mitigation practices. And since that time, in February of this year, they did have a large COVID surge, which was felt to be an Omicron surge, probably B4 and B5 at that time. And now they're having another surge. It's hard to know if it's a completely different surge or if it's just a continuation of what happened in February when shortly after they dismantled their COVID mitigation practices. There is a respiratory disease specialist, infectious disease specialist, who presented some data in April and discussed what he found based on modeling. I want to emphasize that this information is based on modeling, so the numbers can be underreported or over-reported, and I shouldn't even use the word reported, but it could be, that it's less than what he's reporting or more, because it is based on modeling, and I think that's what's really getting picked up, is what he has, based on his modeling, has found that there are 40 million cases of COVID in the population per week in China, and he, based on his modeling, is anticipating that there will be up to 65 million cases a week by the end of June. So what does that mean for us and the rest of the world? China was so unique, in my opinion anyway, China was so unique in that they had extreme COVID mitigation measures, as we have all been hearing about, both from people that we know in person and from the media. It's been extensively covered. We don't know exactly what variants are circulating there, but from my understanding, it is similar to what is circulating here, XBB 1.5 and 1.6.1. So we're not looking at like a brand new variant that we're worried about, but we have to look at the differences. They went from complete mitigation, where people, we don't know the extent of vaccination. I don't believe they were vaccinated against Omicron like we had available here with our B45 vaccine, which also does cover XBB 1.5 and the other XBBs, not as greatly as it did B45, but they are also Omicron variants. So probably weren't vaccinated against Omicron. I don't know, have no idea the degree of vaccination at all there. And they went from complete mitigation to no mitigation. So of course, people had not been infected. So you have a a population that essentially was the same as we saw in 2020, where it was a brand new disease exposed to people who were completely naive to it, except for those who were vaccinated, and some who did, of course, got infected. So very different than what we see here, where we have had 3 years of mitigation. There is still some mitigation going on here, and we have had a lot of vaccine and a lot of infection. So, and many people who have been infected and vaccinated, which gives us even more protection. So I think it's difficult to compare. Again, there have been surges in other countries, such as India, with the XBB 1.6.1, and still here we haven't seen that much of that. So I think that, sure, we know COVID is still circulating, and I know that the feds are talking about whether there's going to be any mitigation in terms of people coming here and going back and forth to China. But just to emphasize that I think that it's a very different situation. It is apples and oranges, but COVID is still circulating, and people do still need to be careful. Vaccinate. I'm told that, or I've read that there should be Omicron vaccine available soon in China. We will be having most likely a new updated vaccine in the U.S. in the fall. So vaccinate, be careful. If one is sick, get tested. Don't transmit disease to others. Thank you. Any questions?
Any questions?
Okay.
So in summary, Dr. Webb, I think we should be cautious but not alarmed, correct?
Yeah,
Good.
thank you.
Thank you.
Cautious but not alarmed.
Wonderful. Wanted to also share with the board first a new program that we're going to be implementing, or actually it's gone live and we've implemented and had amazing response in the first day. We wanted to really understand what were the challenges that our frontline employees were having. Oftentimes when we do rounds and we looked at our HCAT surveys and we looked at our Proscani surveys from our employees' voice, they want to be active. They want to be able to help and design a new system. And they're very excited to be able to contribute new ideas. So to be able to make that happen, we wanted to share with the board in my employee report that we have launched an initiative called the 100 Ideas for Change campaign. And this is an initiative that was designed to identify and improve processes, communication, and care across the system by getting input directly from our frontline team members. Any reasonable or workable suggestion to make Cook County Health better, no matter how small, is welcome. Suggestions can address clinical and administrative processes, improvements, employee engagement, staff and patient safety, technology, and more. The ideas will be reviewed by a multidisciplinary team. Individuals who submit them will be implemented, and the ideas that are fully implemented and selected for the 100 Ideas for Change initiative will be brought before the board for recognition. And so we're very excited, and in the first few days, we have already had a very large number of submissions. So we're excited to be going through that, and it shows the enthusiasm of our team to be able to make some positive changes, and we're very excited about what's to come. And so just wanted to share with the board that you will be meeting some of our members directly and their ideas that they did to change Cook County Health for the better. So it will be a campaign that will be ongoing over the next few months, and we hope to bring you some amazing ideas that make us better. So we're excited to move that forward.
What's a large number?
Large number, I think we've had, Dr. Makaitis was running the initiative. Dr. Makaitis, how many do we have about?
We're about 45 ideas right now.
Wow.
Yeah.
Engagement.
It does, absolutely. So excited. Wonderful.
Question.
Mm-hmm.
When you say recognize, you know it, what does that mean?
Recognize means that their idea will be implemented, they'll be brought before here when it's implemented, and then we'll be able to share the improvement that it's had for the system. And so some of the ideas are really insightful for a caregiver, and so it's how we operate. Our transport department have been suggestions, what time and cleaning and scheduling that sometimes can disrupt certain events for patient care, to even improvements that we can do or how we can maximize our staffing. And so when we always, believe in one of our pillars is systemization. Was the idea is great in one, we pilot it, we test it. If it really is able to drive change throughout the system, then it becomes a systematic process throughout our organization. That idea will then be permanently part of our ongoing operations, will be part of our standard operating procedures, and will recognize the individual and the change that they have made for the betterment of patient care or for our staff.
So we will be recognizing them for their impact. What if there's an economic impact and some expenses are reduced?
Any impact, and so that's what we said, we wanted to make it broad. If it's for patient safety, for operational impact, and that would be an operational impact, because when, the beautiful thing about being a public system, and we share this with our team, is that when we save money, we can put that back into care for our department. So even if it's an economic savings, that means that we're able to expand a service, we're able to increase some new clinical capacity, we're able to reinvest in our system. And so we're very excited about the opportunity to do that. So it would be an operational impact.
Thank you.
Mr. Roach, can I have a question about, are there any high-level criteria you could share about how you decide on what ideas move forward versus others that may not?
Sure. So, there is a rubric that we're going to work with our quality team, and the rubric really looks at the impact to patients, the impact to staff, the innovation, and the ability to be able to be systemized and implemented across our organization. Those will be the ones that are in there. At the end of the day, quite honestly, I think we're going to implement all of them. They're workable solutions, but for the 100 ideas that will get recognized, they'll be the ones that had either a big impact on quality, a big impact on our team, or were truly innovative and something that we may not have thought of or have been missed. And so any one of those impacts would really be something that moves forward and how we're able to move our system better.
Appreciate the initiative. Thank you.
And as part of that recognition, will any of those recognized items be including a financial incentive in terms of not only putting forward these ideas, but those that are actually acted upon, being able to provide a financial incentive to the employee that suggested that?
So that's something that we can definitely look at. Anytime depending, especially for our frontline employees, financial incentives is something we would need to work with our union partners to negotiate. And so I couldn't say yes or no at this time. We definitely want to be able to make sure that great ideas are rewarded. And so we'll start with the recognition and also the improvement, because most of the ideas being submitted makes their work easier, makes it better, it makes it more optimal. And so being able to have a better work environment, and then we'll see if what we can do if there's some recognitions that could be done.
Yeah. It's something to consider, because sometimes people may have that idea, but there's that barrier of actually moving forward to actually submit it.
Yeah.
And so overcoming that to be able to encourage the empowerment from staff is always welcome.
Absolutely. And I think what I've done this program before, and it has done amazing things for the institution. I think the way that you get the encouragement is we're not going to announce all 100 at one time. We announce them as we move forward. So as one is selected to have met the criteria, implemented, and move forward, we recognize them to encourage others to participate. And so they'll be focused on our newsletters, they'll be shared with the board, they'll have the ideas for change, they'll be celebrated with their units, and then we'll make them eligible for the different awards we have throughout our organization.
And if any of the ideas require financial investment, I suspect that there may be discussion for the next fiscal year budget.
Correct. And we always have some availability. If it's going to have a financial impact and an improvement, we'll weigh it out, and we have a strategic department that helps us to align that with our financial resources. So we want to be open, and that's what we said, it's an idea for change, but if someone says we need a new, $9 million piece of equipment, that may be something that goes into our budget. But a lot of the ideas we're getting are really innovative and are things we can do fairly quickly.
Good parking spots go a long way as well.
Yes. Are you submitting one? Thank you. Absolutely, yes. Thank you. Next, on the next slide, we just want to go one back. Thank you. Our next slide is just an update as we go every month on our strategic planning initiatives and some successes we've had across our organization. So for Accomplish, as we discussed earlier, we have increased our leapfrog rating to a B. We also had our CIRMAC team achieve the accreditation from the National Commission on Correctional Healthcare as a Center of Excellence program, meeting their standards, and so we commend our CIRMAC team. We were able to open the Strozier Discharge Lounge that is able to help facilitate and orient patients on their discharge process. process. We have improved our endodontics and behavioral health insomnia services. We created a gun safety section in the EMR and added ambulatory pediatric intake power form and updated our gun safety materials. And what that means is that we will start screening, and if there is a gun in the home, we're going to be providing locks and cases so that you can increase the level of security at home for gun safety. Radiology images and patient portals will be viewed and downloaded with greater efficiency and greater access. We have a new ECHO protocol established at Providence and Stroger. We rolled out our 100 Ideas for Change on patient engagement. We hired a new director of language services, and we finalized a design for our behavioral health spaces at Providence. Also coming soon, and a preview to hopefully the next few months' work, we will continue to have a behavioral health community needs assessment process. It will be rolled out. We have made job fairs for nursing, county care, pharmacy, and police divisions. We will be finalizing our FY22 audit. We also have a launch of the third phase of food care program that will provide medically tailored meals to county care members with complex conditions. We will have ongoing efforts to mitigate the impact of redetermination on county care members. We have a pediatric behavioral health beds in the ED that will be modernized and enhanced. We have a methadone clinic created at our Austin clinic, and we hope to be opening a 16-bed virtual unit to expedite the movement of patients throughout our organization that will be in the ED. And so we look to be able to have those enhancements come forward in the next few weeks. Any questions on those?
So, yeah, please, I have a few. Finalizing the design of the behavioral health space at Providence. What's the anticipated, do we have a sense of when that be presented to this group?
We'll go ahead and schedule a presentation on both the timelines for construction and what we're looking for. And so the finalization was both on a new type of unit that we're looking to create at Providence that maybe one of the first created in both the state of Illinois, which is an immediate crisis stabilization center for individuals who are having a psychotic break and right now don't have a safe space. They don't have medical needs, but they have just behavioral health needs. To be able to go and have almost like a behavioral health emergency department specialized for individuals who need special services. It will also be a 24/7 walk-in urgent care system that we're looking to create. And so the designs for that are underway, and we've been working with that. The second, of course, is some other expanded capacities we have throughout the hospital.
Right, and that's part of the overall, to your point, coming ongoing behavioral needs assessment.
Correct.
I think that leads to the question I was going to ask, the behavioral health community needs assessment, what does that look like?
So the behavioral health community needs assessment is, we're going to be working to release some RFPs to work with partners to do we're working with our behavioral health team and our Cook County Department of Public Health team so that we can be able to reach the whole county. It will be a set of RFPs, and we're going to bring in partners. It will have several components. So one component will actually be a rollout to be able to have many RFPs to conduct focus groups, to hear directly from the patients and the providers, and ensuring that they're diverse both in representation of patients, individuals, backgrounds, and the regional demographics of the county, so that we're able to capture everything across the board, across ages, across the different cultures, ethnicities, identifications, to make sure that we can get a full understanding of what the patients say their needs are and what we can make sure that we're doing the right things. Because oftentimes in the health industry, we'll say this is what we think is missing, and then it's not what the patients need, and there's a fracture in getting the care to really be able to help the patient. So we look forward to working with both our behavioral health team and our public health team to be able to put out and bring in some partners to help us do that work and to be able to do that. We're also going to be doing an evaluation of all the services that are currently available, where they're available, and if there's any voids in coverage, and also response times, and looking at where are the immediate areas that probably need some impact. During ARPA, one of the submissions that we had and was funded by the county was an impact fund. And that fund is being reserved, and we're starting to roll it out, but it needs a community needs assessment to tell us where we should direct the most impacted services to have the greatest outcome for patient care. And so this is the first step that we'll be rolling out. So there'll be some RFPs we'll be bringing back to the board, some more details at that time. And so it's just announcing that we're getting that process started.
Are there any thoughts about having residential units?
We're going to definitely see where that comes from in the needs. I think there definitely is some needs and how that would work, but I don't want to I don't want to add anything to this. I don't want to leave it to be able to have a blank canvas so that they can be able to give us all the details that they say they need.
Thank you.
Any other questions? All right. If there's no other questions on that, I do want to bring forward our interim Chief of Communications and Marketing Officer, Alex Normington, who's going to go over our Cook County Health branding campaign.
Good morning, everyone. I'm Alex Normington, Interim Chief Communications and Marketing Officer, and I'm very excited to be here today to talk to you about our upcoming brand campaign. So, you may know that every year for County Care, we're in market doing a choice campaign. We haven't had a branding campaign for the health system in about 5 years. So when I say I'm excited to be here, I'm very happy that we're able to elevate the health system. We wanted to start with doing some base market research to see what the health system's perception and reputation was in the market. We did that with patients and community members alike. We found a few things. So first, our strengths. When people who knew about Cook County Health thought about us, first they thought about our mission, first and foremost. The second thing they thought about were our expert doctors. And importantly, they see the health system improving. So we have a really good base from which to build a trajectory of positive brand reputation and awareness in the community. When we heard, what do you think about Cook County Health? What do you know about it? Stroger Hospital was often the first answer. Provident was a distant second, and our community health centers were a blip on the radar, unfortunately. So that gave us our marching orders. We need to raise awareness about our community health centers in the neighborhoods where they're located, because ultimately that's where we want to drive patient volume. So for this campaign that we're launching in June, we've got 3 goals. The first is just to elevate Cook County Health's reputation, who we are, what we do. We want to raise awareness about our community health centers, particularly in the neighborhoods that they're serving. And, ultimately, we want to increase patients' awareness and interest in being, coming to the health system for services. This is not going to be a volume-driving campaign necessarily. We do expect we'll see an uptick in phone calls to the call center, maybe some additional appointments. But what we need to do is get our health system's name out there and our clinics a little bit more awareness. I'm hoping, especially based on some of the exciting initiatives that our colleagues are doing related to urgent care, virtual care, and online scheduling, that in future years, if we continue to stay in market, we'll be able to do more volume-based campaigns with a call to action, saying, make an appointment today. Here's what you need to know to take action. And so that will be coming in future years. Next slide, please.
Can I ask a question?
Yes, please.
Can we go back? Okay, elevate the CCH reputation. Who's your target? I know who we serve, but who are you trying to target? I'm coming from a perspective of looking at driving revenue.
So right now, for this campaign, our audience is primarily families, moms of women or women of childbearing age and families, because what we looked at across the system was where we had capacity to take patients, and that's in family medicine, OBGYN, and pediatrics, particularly pediatrics. So we're gearing this campaign mostly towards women in the neighborhoods where we have community health centers.
I have a question. We've conducted a basic analysis, correct?
Yes.
So we have a baseline. So are there metrics that you will present to us subsequent to the campaign to show that there's been some improvement?
Yeah, absolutely. So what we're going to be looking at not only is the initial market analysis that we did earlier this year to prepare for this campaign, we're going to be putting into market a pulse survey as the campaign is hitting market next month to gauge again, closer to the date, what our baseline awareness and reputation is for the health system. We're going to keep that survey in market on an ongoing basis and probably do it on a bi-monthly or quarterly basis. So we're getting a much more real-time pulse of what our current, awareness and engagement is in the community. And then, of course, we'll have metrics, calls to the call center through Google Call Ads, out-of-home impressions, visits to our website, things like that.
Thank you.
Thank you.
Are you doing anything that will impact the thought process of individuals regarding their service, the amount of time they have to wait? The issues that people will raise, even if they don't say it, they have those issues. And we know this is a great institution when it comes down to care, but the services aspect are the ones that would help to pull more people in.
Yeah, and we're working closely with our colleagues in other departments to see see where are those areas where we're seeing improvement. So for this campaign, again, we're really focused on just awareness. We need people to know who Cook County Health is, and then if we can stay in market in future years, which is our hope, is that we can build on that and say, you know, now that you know who we are, maybe you've had an experience with us, now you can say, hey, you can make an appointment online, and that's going to be a huge patient satisfier. That's one of those really consumer-focused offerings that we can use and promote when we have those access points available. If we're able to reduce wait times in certain areas, if we're able to maximize and make some efficiencies there, those are all things that we can promote in subsequent campaigns.
Great.
We hope to do so. You can go to the next slide, Debbie. Thank you. So this year, our creative concept is Your Health Has a Home. We took 3 different concepts to 5 focus groups, and this was by far and away the winner in English and in Spanish. You'll see that we have pictures of our actual health centers with people superimposed, and like I talked about, our audience for this is really families, women of childbearing age. So you'll see a lot of kids, you'll see a lot of families and moms. This is a treatment, you have a bus ad, a bus shelter ad on the far left, a grocery cart ad, a digital ad, and a billboard on the bottom. These are just examples of the creative treatments that we have that will be rolling out. We'll have ads that are geographically dispersed across the county that are really focused in on the neighborhoods where we have health centers. I think what we're trying to get across here is that home is where your heart is, and your health could be at Cook County Health, and we want to care for you like family. Next slide, please. Thank you. So this campaign represents over a $500,000 investment over an 8-week run. We're going to be launching in 2 weeks, later in June. We're going to be out there on Google Search, Google Call, social media, including the Meta platforms, YouTube, and TikTok, where we're actually seeing really remarkable engagement in the younger demographics. We'll have out-of-home, so that's billboards, grocery carts, benches, bus shelters, and buses. The map on the right, you'll see where we have our out-of-home placements. We definitely are geographically dispersed, but we are really saturating in the south and the south suburbs because that's where we have the most capacity and what we believe is the best ability to move the needle in terms of volume. So we really looked for any open out-of-home asset that we could grab in the Southland.
Is there any symbolism by the color coding?
The color coding is based on the clinic, so it's hard to see. I think yellow is Blue Island, Cottage Grove. Oh, I'm sorry, thank you. Blue or brown is Blue Island, so it's just targeted around what health center will be advertised on those out-of-home assets. The purple on the very top is Arlington Heights, then we come down to Belmont, Cragen, et cetera, North Riverside. So that's the color coding. In addition, we're going to be creating a landing page for this campaign, and we're going to be improving all of our health center, the individual web pages that we have, expanding the information available, adding videos, and making those really attractive landing pages for someone to come if they're looking for a new primary care medical home.
I'm sorry, a question. How does this link overall with our overall public health work as well? I mean, we have these campaigns both around this, and we have a public health campaign. Is there a link here?
Yeah, so these are 2 disparate campaigns because, what Dr. Hasbrook and his team are working on are very specific, targeted at, potentially different audiences for specific health states and diseases. And this is really an awareness campaign for the health system. So I think we're, using a lot of the same tactics and best practices to reach our audience, sharing lessons learned, but these are 2 distinct campaigns.
And what I can add, the most important part is the fundamental of the branding. Making sure that people always see our brand, our logos consistently. And so when public health does campaigns, you'll see Cook County Health, Cook County and Department of Public Health to see the overall organization. A lot of times the campaigns that public health does is for educational purposes. So they're trying to educate, inform on a topic to be able to get people to engage in a certain action. But you want us to know that we're doing that. And this is part of our overall system, advancing health in a new way. these campaigns, and you can see in the color coding, which was a good observation from our board member, is where we have the greatest availability. And I'm pretty sure Alex was going to hit on that, but stealing from our presentation, it's where we have the greatest amount of access. And so we have some clinics that we're very fortunate that are full. Like we are in the process of adding more providers to be able to increase the capacity, and they are very popular clinics. We have other clinics that people don't know we're quite there yet. And so this campaign is really trying to get individuals in the services we have available and the locations that we have available to address Director Robertson's question that you're able to get in very quickly. And so it's targeting the places where we have capacity, where we have areas, and people can also know that we're there. And so the overall branding that brings in is that every time you see our impression, it should hopefully bring you more comfort on knowledge of the overall system, but it's hopefully driving you. We have a clinic right here too, so use us for these services. And the pictures and demographics showcase the overall service line. So when you see Cook County Health, you're going to see a mom and a baby. You're going to think, hey, I'm going to take my child there. And so they work together in those services and partnerships. But we do try to have themes of integration, tag, branding, looks, cohesion, but we also want to make sure we're always having the message. So public health wants to educate someone to go out and do and take an action. We do want them to know that it's our brand and our system and their department that's advancing that. And we do try to have some nuances so they can also know this is public health, take an action. This is Cook County Health, come in and see us. And so there's some nuances that our team works together, but there is an overall strategy to interlock them so that we can be known as a system and have that cohesion in our messaging.
Thank you. I think Director Black had a question as well.
Thank you, and thank you for this presentation. I have two questions. One, maybe more straightforward, is there an earned media strategy or interest around this particular campaign? Maybe we'll start there and I'll ask the follow-up.
Yeah, no, absolutely.
Okay.
There is. So we're going to be taking for the next 2 months, the areas that we're going to be heavily promoting. And then on Digital Edge, you'll see a little bit more specificity where it says, pediatric appointments available now. So we'll be working on family med, OBGYN, and pediatrics, and to push our experts out there to say, look, we have expert doctors, which is one of the things we are known for, and reinforce that through earned media outlets to highlight their expertise so it coincides with the paid media that we're doing.
Great. And the follow-up is, Cook County Health is, I think, just as tremendous collaborators and partners across the county. And so the focus certainly on Cook County clinics, but how do you think about activating other partners that serve county care members in their facilities as well?
So we have a really robust community newsletter group. So we've got more than 27,000 partners on an email distribution list, and we're updating them on at least a monthly basis. They also get every single one of our job fairs. So we're actively in communication back and forth with them, and this is one of the things that they'll be getting an update on in June as we try to say, look, this is where we have access. If you have members who need care, please bring them to us. Here's, a beautiful new webpage you can send them to. Here's the phone number for quick access. And those are one of the ways that we work really closely with our CBO partners to try to elevate our reach.
Great, thank you.
I think yesterday or the day before, I went on the website and I saw Change. Change Institute? Yes. So I thought it was super cool. I love the way it looked, the idea that it was actually giving us. Now I became inspired by it. My question is, in your advertising, are you saying anything like, you trusted us to get you through COVID, and we did that. We did it at a remarkable rate, and we led the nation in it, or whatever the statistics indicate. Now trust us to keep you healthy on a day-to-day basis, because there's a lot of real estate that you created there. I mean, it was fantastic. I think anyone who was anywhere near Cook County saw that Cook County did it in a way that was absolutely fantastic. It looked military-like, the way it was done, so structured, and had people coming in, coming out, popping it up where it was located. It was something to be applauded. Absolutely fantastic. Can we build off of that?
I'm really glad you asked that question. We talked about that in our market analysis because we know over the last few years how aggressive we've been in communicating about COVID, how robust our mass vax and other initiatives were, and then also the media spend that we had around COVID too. That wasn't necessarily related to our brand and reputation as a provider, but more COVID awareness. So what we found in our initial market analysis, people said, thank you. You all did a great job during COVID. But we didn't see that translate into changing their minds as using us as a provider of care, which was, I think, a little surprising to us, because we had the initial thought too, because, we wanted to capitalize on the last few years where we were really a leader in the region in responding to COVID, and we generated a lot of trust, and we served a lot of new and unique patients that had never been to one of our facilities before with our vaccination efforts. So, in our market analysis, we didn't see that consumer behavior translating from, you took care of us during COVID, now I want to use you for primary care, which was unique indeed.
I'm agreeing. My question is, can you use that to drive and to change the mindset? Because before stepping into a facility, you may say, oh, no, I don't go to this place. But once you stepped in there, you're like, oh, wow. And the precision in which the operations was just absolutely fabulous. So my question is, can you take that bounce and use it to change the perception? Because the reality is, we are that great. But the perception is, So that's the question.
Yeah, no, and I absolutely hear what you're saying, and it's something that we've been thinking about. I think in some of our messaging, we can allude to all of the work we did and how many people that we did serve, and say, now trust us with your ongoing care, right? So we can absolutely add that into some of our language for the, copy on the website and such. What we were interested to see is that folks didn't necessarily initially see that connection for using us for ongoing care. So when we were creating the concept for this campaign, we knew that we couldn't rely solely on COVID. We really had to create another feeling of, what you'll see here, warm family home, to hopefully drive people in.
What I would also add, following up on your comment, that is in this contract, in this campaign, and that does incorporate your point. One of the things that Alex presented early on was that when people heard the name Cook County Health, people thought of Stroger alone. And so someone in, 20, 30 miles away from Stroger may not be inclined to change their model. So part of what we're helping to do is to show that there is other clinics. So really highlighting where we have footprints, and that's what this does to tie to the locations, to start connecting that Cook County Health is more than just Stroger. It has, 14 sites across, 15 sites across the county. It has a public health department, a juvenile detention program, county care. It's this robust health system. And so I think this is just trying to plant those seeds so that we can take it to the next level that you're proposing, because we do want to capitalize on that and continue the initiative. The numbers were not no, it was 1 in 3 or 1 in 4 said they would be willing to open to it. But I think if people know that it could be, 2 blocks from you, that will increase even more. And so we are going to be looking for ways to be able to showcase our success and our quality and what we're doing to move forward, tying back to what we did to COVID, but also saying, we're COVID, we now do very well in our quality ratings, here's our performance, and all the different milestones that we continue to achieve as a team, and make sure that people have that brand recognition that coming to Cook County Health is coming to one of America's best healthcare systems, and making sure that they know where we're located. So we will be increasing that. This one's really starting to really tack on to think of family and service lines, but to understand we're more than just Stroger. We have these wonderful locations here. And so wherever we have capacity in any location, we want you to know it. So you're not going to hopefully be able to move too far in the area without knowing Cook County Health is there. And we'll continue to move from there and incorporate what you're looking at as well.
Thank you.
Yeah, and in addition to, raising awareness across our communities, one of the other things that I'm really excited for is just the morale boost I think that staff will have. It's been a number of years since we've had a true reputation campaign in the market. It is, going to be sharp, professional. It's going to be everywhere. And so that's something that people can point to and say, I work there. And so I get a lot of really good feedback when we have campaigns like this, or even like a really well professionally produced video, that people love seeing the health system showcased in such a positive light. So that's one of the things that I'm looking forward to as this rolls out as well. Can I answer any more questions?
We appreciate it. I mean, baseline too. We appreciate starting from the baseline and the big steps and, the fact to shape our own narrative and our own message. Otherwise it'll be shaped for us. So we really appreciate it.
Yes, thank you.
And
We've got an
just two-
exciting path ahead.
Absolutely. Two things that were questioned that we wanted to bring up that are different initiatives, where we will be briefing you. So part of the change institute and appointment availability, we have had our informatics team working with a digital team to be creating a new way to access care that we'll be bringing back to the board. So we talked about that it can at times be difficult to get us. And that was something we heard very quickly. So we have been working on an initiative that hopefully soon we'll be able to bring back and discuss what we're hoping to launch with a launch date, hopefully very soon, that we'll talk about some of the first phases of enhancements that make it much easier to move forward. Because part of the Change Institute initiative is that we do want to move the front door of healthcare. Because sadly, in a great way, it's both good and bad, is that we have done so much to advance healthcare and moved healthcare light years. But what we haven't done as much in changing is the front door. So all of your healthcare encounter starts with you having to see a doctor and go to a clinic. And that in person, and that physical action is so limiting. So all these patients stand waiting to go through the door of access. And so even as we're ensuring we're getting more people covered and more individuals, if we're not creating more doctors, we have a problem. That's why we are so proud of our Providence Scholarship Fund that's working forward to create more doctors and nurses. But if we don't create that capacity, the technology sit on the other side of a wall that people can get through. Our initiatives is trying to make that easier. So how can we use new advancements in digital technology and communications to get patients quicker access? What else can we change? What dispensations can we get to make it easier to diagnose if someone has a cardiac condition so that we get the statins faster to them? And so those are some of the work that will be done, but that will be in time. The first phase is get the appointments easier, get a few digital access. And so we'll have some innovations to be coming up very soon. And on the referral network that Dr. Bab talked about, having other partners, we do have something called the Cook County Health Referral Network, where we do work with primary care clinics, FQHCs. Cook County Health has amazing specialists. And so we are working with many, even smaller safety net hospitals on how we can be able to partner to expand our safety net services and be able to partner to be able to have a larger referral and tertiary care network for our different systems, since we are so fortunate to have amazing specialists at our institution. And so we'll be able to give some updates on that as well.
Thank you. This is an excellent campaign, particularly moving care from the usual door of entry, which might be the emergency department, to community health, which is easier access, easier hopefully to obtain an appointment, and for the preventive care that we spoke about in our patient care committee, to be able to address that prior to the acuity and cost that might incur at an emergency department.
Very much so.
Which should in turn drive up the reimbursement from CMS as we lower that number. So this is starting to sound good.
Great, absolutely. So good.
Any further questions? No, thank you. First of all, it's a lot of engagement, so thank you, Director, for the engagement and questions, thought process. It's been really good. I know it's really sad, but I think we've exhausted our agenda for today at this point. Any questions before we close then? As the agenda has been exhausted, the chair declares this meeting adjourned. Thank you.